All right. Well, as people get logged in and everything, we're going to try our a Zoom meeting here to a webinar, if you will, to kind of address facial aging and facial rejuvenation. And I am Sternberg. I'm a board certified plastic surgeon at Montevita Plastic Surgery. And I'm joined today by our newest nurse practitioner. She'll introduce herself.
Hi, everyone. I'm Kimberly Saffman. I'm an adult nurse practitioner. And yes, I just joined Montevita Plastic Surgery in January, so I'm very excited to be here in Florida. I moved recently from New York City, so it's nice to be in Sunshine State.
Yeah, we're happy to have Kimberly with us, and I'm happy that she's not in New York at the moment with all this COVID going on. So we're going to talk today about facial aesthetics, rejuvenation, the aging face, what we can do about it, both non-surgically and surgically. And if anyone has any questions, I don't know if you're new to Zoom or have ever used Zoom before, in the upper right-hand corner, if you're on a laptop or an iPad, there is some icons up there where you can mute and unmute yourself. If you're unable to do that, you can go to more, where there's a button with ellipsis, and you can push more. And on that, you can raise a hand to ask a question, or just give a symbol like a thumbs up or a clap, and then we'll see that you have something to ask, or have your hand raised as it was. So other than that, we're going to mute all the other participants so that there's no background noise, and we'll go from there. So we're going to start off with the facial anatomy and the aging face, and then from there we'll talk about Kimberly will talk about the non-surgical options that we have for facial rejuvenation. And I bet you a lot of you know many of those options because they're so widely seen in magazines and media content, social media, and all that kind of stuff. But those would be your non-surgical avenues, would be like your filler, your Botox, non-invasive lasers, and your surgical options, of course, would be facelifts, eyelid rejuvenation, fat grafting, that kind of stuff. So we'll talk all about those. And if you have any questions, go ahead and ask. So with that, I'm going to try to share my screen here if I can and show some pictures. So we're going to start with this. This is the facial anatomy, kind of the superficial texture of the skin. You can see on the left-hand side of the photo, you can see the skin and the texturing of the skin. On the right-hand side of the photo, as you're looking at it, you see the deeper surface and the deeper anatomy, the fat compartments of the malar and the jawline around the eye, and you can also see the muscle anatomy. And in the next picture, I'll show you also the bony anatomy, the bones that underlie the facial structures that hold everything in place. So the first thing I want to point out is in the 35-year-old patient, or in that generation of patient, what you're seeing here is this inverted triangle that you see right here. That is basically showing that in the youthful patient, the structures of the face are very full up top, and you're more like an egg, like an egg with the kind of inverted egg. The nice full facial structures of the temples, the upper brows, and the eyelid margin, the malar area, the cheek process. The cheeks are very full in this patient, and then you get more narrow towards the end. As we go over to the older patient, in that age, we have we've inverted the triangle to now where the soft tissues have sagged down, and we have more fullness along the jowls, a more heavier and fuller lower jaw area, and less volume in the temples, the forehead, around the eyes, and in the malar area, which causes these labial folds. So you can see, and the reason for that is if you see in the middle picture, you can see the facial anatomy changes underneath the skin. You have the decrease in the fat compartment. So you can see from the leftmost picture in the youthful patient, very, very full fat compartments with very little space between them. As we are middle-aged, we lose some of that fat compartment around the eyes and the malar area especially. And then as we get older than that, into the 60s, you're seeing significant loss of malar volume, that lower lid tear trough volume, significant loss of volume in the temple area, and then along the jawline here, we've lost a lot of that fat as well. On the other side, you can see the surface changes. You can see the architectural change in the skin from loss of the collagen and elasticity. You have more facial rhytids, lines in the skin, textural changes. Some of that brown spots will come up at that point. So you'll have that. And if we dig further deeper underneath that, we're looking again now at the facial soft tissue structures like the fat and the muscle. But as we go to this side over here, we're also seeing the bony structure of the face. And this is really important because in the youthful face, we have a very large I should say a very large amount of bone around the bony orbit, and in the malar area, you can see the thickness of the malar, the zygoma, which is this bone right here, and along the jawline, you can see how thick the jaw is. As we get into the more aged patients, you see that there's bony resorption. There's resorption of the bone, which causes the increase in the volume of it, so more space as the bone resorbs. So that's why the eyes kind of get more depressed, because there's more room in there. So the fat pads tend to kind of flatten out and herniate, and the eyes get more recessed in the globe. So it leaves more tear trough and more thinning of the soft tissues below the eye. You can see the zygoma here is much thinner. The bone is resorbed there, and you have more a thinner zygoma, so it doesn't hold the soft tissue structures as well. You also see along the jawline that the jaw itself, the actual bone is resorbed, and there's less of a jawline, less prominence in the jawline, less to support the soft tissue. And so some of that soft tissue descent and jowling and that kind of stuff. And the final thing I'll point out is you can see with resorption in the maxilla right above the teeth, you can also see some lines as you start to see the prominence of the dental ridges, and that leads to facial, to the architecture of the lips as you start to get fine lines and wrinkles on the lips. And then the final thing is that the actual piriform of the aperture of the nose enlarges, which causes more sinking in the piriform area. So you get that nasolabial fold and hollowness around the base of the nose because of the bone changes there and along the zygoma. So you can see all that there. So I think that's really important for people to see that, to come in, we're going to assess their face and decide what procedures we're going to use or what fillers we're going to use or how we're going to neuromodulate the muscles to address the movement of the muscles and the skin animation. But to understand the deeper subanatomy, the soft tissue pockets and the bone, to see how that changes with time really helps explain and put in context what we're battling against. We're battling against loss of fat volume, decrease in muscular fullness, and obviously the bone resorption, which as you take away the scaffolding or the building blocks of the face, you're taking away that volume, and that's causing more atrophy and more descent of the facial structures. So that is what we're trying to combat against. And with that, in light of time, I'm going to stop sharing that and then have Kimberly talk about what happens when you come to our office and you see our nurse practitioners, all the talented girls that we have here from both spatial aesthetics and nurse practitioner standpoint, and what they can do from a non-surgical standpoint to help revolumize and rejuvenate all those aspects we just talked about. So I'll hand over to Kimberly.
Thank you. Well, the good thing is that we have a wide range of products and devices in our aesthetic armamentarium to help reverse and improve signs of aging. And our goal is always just to help you to maintain your best self. We can do that with neurotoxins. Neurotoxins are probably the most common thing that we're using right now. As nurse practitioners, many people are aware of Botox. It's a common neurotoxin. What we can do is we can treat the muscles between the eyebrows to actually, muscles between your eyebrows actually bring the eyebrows together and kind of create a frown. So by treating those, you can open your eyes up a little bit. We can also in conjunction treat your forehead to kind of smooth out the lines that you may have, kinds of lines that can happen over time with sun damage. So we can also treat around your eyes to kind of open up the crow's feet and help with some of those lateral lines. Some fun things with Botox that not everyone is aware of is that we can give you a slight brow lift along the lateral brow to kind of elevate your eyes even more. And our goal is always to give you a more well-rested look. We're not always looking to make you look frozen or surprised. The goal is always to just make you look more well-rested. And typically you'll have minimal to no bruising with Botox injections. Another interesting thing that we can do with Botox is we can actually give you a lip flip. So a lot of people who are interested in possibly doing something to their lower lip or their upper lip, or just even to increase the fullness or appearance of your lip, we can give Botox on the upper lip to evert that pink portion of the lip. And then if you decide that you'd want something more for your lip, we can treat that with filler. Another thing that we can do with Botox is help with your smile. Some people, as they age, see that their smile looks more like a frown, especially at rest. So we can treat your DAO muscles and we can elevate your frown by doing that. We can also treat the masseters, which are the muscles back here. Some people from TMJ have strong, bigger masseter muscles. Other people may just have them larger because of their genetic predisposition, and we can treat the masseter muscles with Botox to kind of sculpt the lower face. So those are the typical things that we can do with Botox, which is a neuromodulator. It lasts about 3 to 4 months. And we can also use fillers to replace the structure in your face. So as you saw in the models, your bone resorbs and shrinks. So as the bone changes and as the soft tissue changes, we can use fillers that are either hard or softer in texture, and they're usually hyaluronic acid is what's most commonly used. So hyaluronic acid is something naturally occurring in the body that produces hydration and helps to plump the skin. So we can use these fillers to create more structure in the mid-face, so along the cheek and bone, to try and help to elevate some of the nasolabial fold that may form with aging. And we can also help to improve the appearance of some of the fine lines around your mouth. We can help to improve the texture and appearance of your lips, because as we age, our lips actually, from the top pink of the vermilion border to the bottom pink, this actually shrinks and kind of inverts. So a lot of people will notice that their lips are longer horizontally, and they're kind of everting inwards and shrinking. As well, your commissures, which are kind of like right here under the lateral side of like the pink, they deepen. So we can use fillers to fill in this area as you're starting to see some shadowing and some marionette lines. And we can also help to plump up your lips and to give you more support, structure, fullness in order to continue to balance your face out. So the last thing that we can do with fillers is we can help to restructure your jawline. As you saw in the models and pictures, your jawline is also remodeling. So we can give you some filler to try and recreate that line and, you know, do as much as we can to support the structure of your face. Do you have anything else to add, Dr. Sternberg?
I was going to share my screen again with you and just show you some more, you know, pictures before and afters of what you've been kind of talking about. You can kind of walk us through it, but where is my? I'm just trying to look for these. There we go. So we're going to show some filler pictures here for both lips, and I'll kind of walk through it, and you kind of tell me what you think as well. So here's a patient in her late 50s. In fact, when her daughter was getting married, and so you kind of touched on the resorption of the soft tissues, and we generally use like a 1 syringe per decade, kind of is a good starting point for when people ask me, you know, I'm in my 40s, how much filler should I use, or when should I start Botox? You can answer that, but usually I'll tell patients in their 40s and 50s that you're going to need to start with 3 to 4 to 5, depending on how many to get to vials of filler, or to get you to a good, you know,
before and after, you can
balance.
see how, in the before and after, you can see how there is more visible pink in the lip, and also the area where the marionette lines, you can see that area, the medial portion. So if you're looking at her marionette line, the space between the 2 lines right here is softer, if everyone can see that. And also we have like more fullness to the lip. Yeah, that's perfect.
Yeah. So in her
yeah,
4 to 5 syringes of filler, and you know, using in the you can see the injection. This is right after the injection. You can see injection in the area of the zygoma of the malar area to kind of improve the fullness here, which helps to improve the nasolabial fold. Also, injection of filler material into the nasolabial fold, the marionette or the oral commissures that we talked about just briefly, and then you can even do the lips as well, shown on the picture of the lips. But you can see with just a few syringes, You get a nice improvement in this area of the marionette line from here to here. And you also get a nice improvement of the cheek and the whole cheek volume over here compared to with the lack of cheek volume in this area before. So you can see that there. And as we skip to the next picture, this is a younger girl, obviously, and all she had was her lips done. But you can, lips are very, very common, and patients really enjoy getting their lips. They're always afraid of getting too much in their lips. But I just tell patients that you can be very modest, and there's nothing wrong with doing one syringe first, and if you love it, do another one in 3 to 6 months, or if you want a little bit more, you can do it sooner than that. But there's no reason to have to go to this Hollywood, over the top housewives kind of look, where she has a very nice improvement with just one. To actually use 2 syringes on her, one on the upper lip, one on the lower lip, to improve the not only the upper lip fullness, but also the recess of the maxilla there. What recess, we can also feel the upper part of the maxilla and the lips as well. So that's 2 units of filler in the lips area. Anything to add to that, Kimberly? Another lady, so in the first picture here, I'll highlight that area. In the first picture here, this is before anything was done. And at first we wanted to improve the lines and wrinkles around her mouth. So you can see with animation in the second upper picture over here, with animation of the mouth, you get these vertical lip irides or banding that occurs from the orbicularis muscle around the mouth. Those lines that are obvious with animation, whereas they're not there all the time, there's very mild without animation. Botox is very good for that. Like Kimberly was saying, injecting Botox into the upper lip and the lower lip really weakens that muscle, the same thing as it does on the muscles around the eye. And you can see in the picture below, the following week, once Botox is kicked in, now we're pursing her lips. She has less wrinkling of her lips with the same animation that she was doing before. So the pursing, that animation movement has gone down with just Botox. The difference between here and here is that this is after before doing filler, and this is after doing a little bit of filler. So in this bottom right-hand corner, we've had a week after her Botox treatment. So you're seeing the difference in the decrease in lip animation lines, but you're also seeing that day we also did filler. She loved the way that there wasn't lines anymore, and now she wanted to add a little bit of fullness to her lips. So we just did 1 syringe of filler. So you just have a little bit to the top. You can just see a little bit more demarcation of the upper lip. Upper lip vermilion border, and you can see the lower lip is fuller as well. There's a little bit of swelling post-injection. There's a little bit of swelling which goes away after the first week. But now we've treated both her animation lines, which is what the neurotoxin does, and the lack of volume, which was the filler does. So that picture shows both the animation and the volume differences that can be achieved with these different non-surgical modalities that have very nice outcomes. And I think this next photo, you can see a before and after lip augmentation. Our full lips, a very young lady, obviously, but some women just want that just a little bit more, improvement of the Cupid's bow, more fullness and softness of the lips. That more the volume does add more, almost like a shine, or to the lips as well. So it gives a better projection. Anything to add, Kimberly?
Yeah, the other thing I just wanted to add is that, oftentimes if you're younger and you're just, starting to think about dabbling with neurotoxins or fillers, it's nice to kind of see what we can accomplish just by doing a lip flip on the upper lip. And then sometimes I'll have people come back in 2 weeks, and then we can talk about, how much filler you might need at that point. And especially also with with an older person as well, or mid 50s to 70s. Sometimes it's nice to just start with a neurotoxin, and then, it helps us to educate as well.
Exactly. And so that's what I did with this lady. Is before she addressed the volume and the animation. So we treated the animation first with Botox. And so this is a week later, but we didn't do the volume at the same time. Now that she saw that she liked the improvement with the neuromodulator, so she doesn't have the lines anymore. Now she just wanted the improvement in the volume. So a week later, we injected her. So that's very common, especially for patients who are new to fillers and neuromodulators. You don't have to go big or go home the first time. A lot of us are very comfortable starting at smaller amounts and doing a session with just a little bit to get some minor improvements, maybe get maybe get a, oh, wow, what have you done from your closest friends, people who know you see the most, and then decide if you can build on top of that. You don't have to do it all at once, or you don't have to go too much at one time. So, so that's that. Before we get too much further along, there was a question from for one of the attendees, and this is for you, Kimberly. She was asking for someone that's in their mid-30s now, who's a reformed sun worshiper and used to be in the sun a lot. What treatments would you recommend to proactively combat the aging, and what maintenance would you entail, or would that entail after the initial treatment?
So someone, for everyone, whether you are a sun worshiper or not, the most important thing is sunscreen always to prevent aging. So I would definitely recommend always wearing a sunscreen every day, even if you live in the colder temperatures. I mean, in Florida, we're always going outside, we're in the sun. But remembering to put sunscreen around your eyes, around your ears, your neck, the top of your hands. All of that can definitely help to prevent aging. One of the most important things. And then at nighttime, using a retinol is a good place to start, because we know that retinol helps to reduce fine lines and wrinkles. So those are probably the two most important things, especially if you're wearing a retinol, or using a retinol, you should be using sunscreen, wearing a wide brim hat when you're outside, and some sun protective clothing. And then the treatments that we do, we'll get into it, but we can do things with BBL and some of our lasers to help take away some of that sun damage.
Yeah, I was going to say for sun worshipers now in their 30s, the best thing obviously to have an in-person consultation, but for most of those patients, you're still gonna have pretty good volume because you're in your 30s. So unless you're a really thin, runner type or something like that, you're still gonna have good volume. So it's not going to be as much about volume as it's going to be, to me, just thinking about a 30-year-old sun worshiper, it's really going to be about skin maintenance. And it's going to be a lot of maybe upfront, stacking it up heavy upfront with like we're touching with lasers, BBL, stuff to reduce the sun spots and photo discoloration. And then maybe things like peels and fractionated treatments to improve this texturing of the skin, to improve the skin texture and help get some that nice resiliency and turgor back to the skin. All the while using this good medical grade skin products that go into the deep dermis and help to really affect change in the dermis itself, how much melanin is produced, so you can decrease the darkness or the pigmentation of the skin, how much collagen is produced, so you can increase the thickness and the resiliency of the skin, and then reversing some of that damage that was done by toxic and environmental exposures. So, that's it's a really multi-part question to what you would do to a 30-year-old. And certainly neuromodulators would start at around 30s, in your 30s, to prevent eyelid, the eye change of the crow's feet around the eyes, and maybe some of the scowl lines between the brows. But I think for a sun worshiper in their 30s, the mainstay of treatment is going to be good skincare and with topicals and skin maintenance with retinoids and medical grade skincare with good sunscreen, and then starting to add in some neuromodulators at that point if people are really starting to notice any lines. As far as maintenance, it's one of those things that I think it's one of the most cost-worthy things to spend your money on is skincare, because just like buying a new car, if you never wash it or wax it, that's going to fade. It's the same thing with the skin. I think money spent on treating the skin surface, the skin structures is just going to pay off dividends. As you get older, you'll have much less aging and photo damage, and you'll be well ahead of the general population. So as far as maintenance, there's always maintenance that goes into a good skin health and skincare program and regimen. But I think it's so important. It's money very well spent.
Yeah, and I just think one other thing to understand as far as the skin integrity, texture and tone, and color goes is that as we're able to remove some of that sun damage and the pigment with chemical peels, with good skincare, with sunscreen, or any other devices like our BBL or our halo, your skin will shine, and it shines because we're removing that pigment. It's basically covering your nice shiny collagen inside your skin. So it's kind of like an interesting thing just to think about.
Hopefully that's answered your question. If not, leave us another comment. And then Kimberly can comment on this. So with tear troughs in a young patient.
Yeah, so we can use we can use a soft filler to mask some of the depression of the tear trough, so that we can hope to improve some of the concavity that can form as we age and some of the appearance of dark circles.
Yeah, so you can see this before and after of a young patient who has beautiful eyelid symmetry, and her brows are nice and high, and she was just bothered by the early tear troughs. And so a little bit of filler right in the tear troughs just kind of blends away that that line, the nasojugal trough or the tear trough right at the base of the eye, where you can see the lower portion of the bony orbit of the eye, and you can just blend that in so nicely on there. So I thought that was a really good job that the nurse practitioners did on that. And here's a neuromodulator. People may have seen results like this before, but this is a patient doing the exact same scowl before having Botox and after having her first Botox ever. She was just thrilled. I think what's important to notice is not only does she have an improvement when she's forcefully trying to create that scowl, not only does she have an improvement in those lines, but you also see the resting lines. She does not have the same amount of animation. So even upon rest, she has a more relaxation of the brow, the furrow in the brow. So not only when she's animating, but also at rest, you also notice an improvement at rest as well, because the resting tone of the muscle is also reduced. So you get a nice improvement. And if you can do this early enough, you're able to kind of prevent those lines from getting worse or for progressing. And if you really start early on Botox, you can prevent lines from ever even happening if you're good about your Botox regimen. So I thought that was a nice picture to show. And another lip filler of a patient who wanted to be very modest, not have really anybody notice, but just wanted to add volume to her upper lip. So you can really see the improvement of the Cupid's bow and that volume to the upper lip. And it doesn't even look like she had anything done. Super happy. And what will you do, Kimberly, with this? How long will this usually last? And how long does the procedure take?
So the procedure usually takes about 30 minutes, maybe less. We will apply topical numbing to help with the discomfort, and in the injection, there's usually lidocaine. So usually we can get hopefully about 12 months out of this, 9 to 12 months. It's important to remember in the lips, we're using our lips all the time to talk and eat. So sometimes some people will notice that their filler, may last closer to 9 months instead of 12 months, compared to like the mid face where it might last a little bit longer.
Yeah, so that's another nice picture.
I also think that we all just get really excited about having our lips filled, but then you kind of just say, oh, it's wearing off, but you just want like a little bit of a top up. You kind of want a little bit more, so.
Yeah, I find it's one of the most things that probably people are most hesitant about because they're so hesitant about getting that overdone duck lip, like overdone look. I always tell patients that my patients and the patients I see from the nurse practitioner are so happy after lip filler, because their concerns have just been alleviated by the fact that they just look very like normal and natural, restoring that volume and not looking overly done. We all have patients that love those big, full, really overdone lips, and they know who they are, and they come in for more and more and more. But that's not the norm. The norm is a very nice, natural appearance afterwards. You really don't want anybody to really even be able to tell, just to where the lipstick fills up naturally. There's no crevices or cracks for the lipstick to get into, and everything looks nice and perky. So I think that's probably one of the biggest fears that are always alleviated after we do this. They're like, wow, I wish I would have done this sooner. That's one of the biggest things about fillers for the lips.
Yeah, and we can tailor which product we choose to use based on what our patients are looking for. So sometimes if you just want to have a hydrated lip and you're not really looking for as much of a plump, you can use something like Volbella to help with some of those fine lines that are forming in the lip, make your lipstick go on a little bit nicer, and sometimes help for some of the lines around your mouth.
This may be a good time to get into the lasers. To do lasers.
Okay, so we can start with BBL. So BBL is broadband light. Our device is from a company called Zyton. So what this device does is it targets pigment and redness primarily. It can also help to stimulate collagen production and help with basically just the process of aging. For treatment of pigment, we can target any light brown or dark brown on the face. usually for skin types 1 through 4 to 5. Sometimes, depending on the consultation, if you have a darker skin type, we may want to use different device for your skin. But with the BBL, we can treat some of the nasal vessels, like little vessels around your nose. If you have rosacea, we can treat that. And then we can also, once we get you corrected, we can begin a Forever Young treatment, which is every 3 or 4 months, you can come in and we can treat your face to just continue to kind of erase some of that sun damage and environmental damage that your skin is undergoing every day. And also we can stimulate the collagen to help to continue to plump and hydrate your skin, and just to continue to give you more of a refinement in the tone and texture of your skin. So BBL is actually one of my favorite treatments because if you stick with it, it's just another thing to add to your skincare regimen. And we also have Halo, which is a more ablative device. So Halo, the best way that I like to describe it is the downtime is about 7 days of pink to red skin. You may have a little bit of peeling on the 3rd day. When I say peeling, your skin looks more like a very, very fine sandpaper texture. We can combine the treatment with PRP, where we can spin your blood and give all of your healthy growth factors back to the skin, where we've created channels with the Halo device. So with the Halo, it takes about, I would say, 30 minutes. You'll numb, also offer some Pronox if you feel like you just want to feel a bit more calm and comfortable during the treatment. But what that does is it helps with fine lines, texture, pigment, will help with some redness. And as I was saying before, when you're taking away some of that pigment and erasing some of that damage, this allows your own body to produce hyaluronic acid, which is what we use in fillers, and it allows your skin and your collagen to shine. So that's why a lot of, you may see some of the side time promotions of getting that halo glow. That's kind of how you get it, because we're erasing some of that dark pigmentation that just occurs with time. And we also have some pretty cool devices in the office where we can do a consultation and show you with a black light how much sun damage you have, because, or just how much damage you have, because it's kind of like remarkable when you see your face under this light and you can see all the different texture irregularities and pigment. So that's a fun thing to do if you ever want to come in to visit us.
Yeah. So tons of non-invasive, or non-surgical, I should say, modalities, because they are kind of invasive. But we talked about neuromodulators, we talked about fillers and the different brands and types of fillers. That's something more to delve into once you're here talking to your practitioner about which ones to use. And then we talked about lasers, and we touched on that. And these are all things that will be done in the office under different types of topical anesthesia, whether it's topical or just low blow-by nitrous oxide, like she was talking about with our Pronox system. And of course, some things may require multiple treatments, in which case we would kind of create a package or a schedule for you to have these kind of done. And none of this is done in and of itself in a vacuum. It's all done with consultation and working together with our skincare estheticians, who are really good at maintaining the product that you get afterwards, and continuing to keep you, youthful and maintained throughout the years. And also some patients will choose to see their surgeon at some point when they're getting up to that 5th, 6th decade, when they're using 5, 6 syringes of filler each year. And they're kind of getting that little filler fatigue, what I call it. They're kind of done with filler and they want to see what other options may be available to them that are more long acting and have a better longevity. And that's when the nurse practitioners or the estheticians will send them to the surgeons. We have 5 surgeons here that all perform facial aesthetic surgery. And then I'm not really going to go into all the different types of facial aesthetic surgery. We do a lot of different things here in our operating room. But basically, we're talking about with facial aesthetics, we're talking about periorbital or eyelid rejuvenation with upper blepharoplasties, lower blepharoplasties, brow lifts. We're also talking about fat grafting to the face, using fat from a different part of your body and injecting that to the portion of the face that we saw earlier. The areas where you lose fat, we'll restore that fat along the malleol, the jaw, in the nasolabial folds, and along the commissures, and the lips, around the eyes and the temple areas. So those will be areas for fat grafting. And then of course, the different types of facelifts, whether it's a mini facelift or a full facelift or a neck lift, and all those combinations of those things. So all those entail general anesthesia. with a surgical incision and some healing time. They obviously have longer downtimes and longer healing times and cost more than your non-surgical modalities. But at some point, you know, a lot of patients will transfer to a more surgical procedure to have a longer lasting result. Now, I tell my patients the same thing I just told the other patient that just asked that question, is that you're never really done. You know, a facelift procedure doesn't last 25, 30 years. We'll be bouncing back between, after your facelift procedure, between continuing with good healthcare, skincare regimen, and then also some of my patients still continue to see the nurse practitioners for Botox around the eyes and fillers around the around some areas that are still having some lack of volume. So this is not, none of this is in and of itself in a vacuum. That's why we have this aesthetic practice with so many providers, and it's really done in concert. This all works together. Just like anything else, when you're going for a tune-up, you know, we're fixing the skin surface, the underlying skin structures, the skin, the bone. I mean, all that is getting we're working on all those different things, and that's why we all work together so well. I don't think anybody that gets the results when they're super happy with the results are ever unhappy that they spent money first doing neuromodulators and Botox and fillers. I don't think they're ever happy that they went to surgery. I mean, they're ever unhappy that they went to surgery. I think if you ask most patients, they're like, I'm so glad I started off with the non-surgical stuff, made that last as long as it would, then went to a surgical procedure, and then continued to bounce back and forth between additional peels and lasers and fillers and stuff throughout aging, to really maintain that product and really maintain your skin rejuvenance and youthfulness as long as possible. So that's what we're trying to do. With that, just some quick pictures, just to kind of go back into some of the procedures that can be done with surgical modalities. Let's go. I think I pulled up the wrong file. Let's just show some of these. This is another picture I should have shown earlier. This is a Kybella patient who just wanted to have some, this is a non-invasive Kybella treatment, which is absorbs fat. You can see this area here and here. She just had that little build of a bulge in the neck that she wanted to get improved, and just one vial of Kybella, which is a solution that you inject into the subcutaneous tissues in the neck, and it kind of dissolves the fatty substance in the neck and helps improve the jawline, the contours. So just one syringe, one vial of Kybella was used there and gave her a better contour and profile to her neck, and that was enough for her. So again, we don't jump right into surgery for patients who don't need that. So the next patient is a facelift patient. We did her eyes. You can see the improvement in the upper eyelid skin, removing the upper eyelid skin and taking that away. Lower eyelids weren't really done at this point. Just some laser was performed to the lower eyelids just to tighten the lower eyelids, but that's why you still see some of that bulging fat on the before and after. That wasn't treated. It was just a little laser in that area. But the upper eyelids were performed in the face, tightening with a facelift procedure and face and neck lift. So the neck is smoother, the contour of the skin is better, the jawline is much nicer. She does have more volume in her malar area, but that's because number one, she has a slight smile in this picture, but also when we pull the soft tissues of the neck up, we're pulling that up and creating more volume in the malar area as well. So the cheeks get fuller with a facelift and the jawline gets straighter. You lose this heavy jowl area here when you're pulling that back up. The neck obviously gets smoother. You can add laser procedures to this at the time of surgery. You can also add fat grafting at the time of surgery on patients that are lacking fat. We can fill fat at the time of surgery, but some patients choose to go back and just continue doing some fillers after the procedure. So all of those are options for facelift procedures. We obviously do men and women. So improvement in the jawline and then in the lower part of the neck. So you can see that there. And I'm trying to make this. And that's some pictures there for facial procedures. So, you know, we have a full board state approved and licensed surgery center here in our office. Our main office is the beach, and we do all sorts of facial procedures there. We do have some deeper lasers, unlike the more topical superficial lasers that Kimberly was talking about with 3 to 4 days of downtime. Some of our resurfacing lasers will have 3 weeks, 4 weeks of downtime with a really significant resurfacing procedure. And I'll show a picture of that right now. So this is a lady who had no facelift surgery done at all and no eyelid surgery done. The only thing she's had is a laser procedure in the operating room under general anesthesia. She was totally asleep. We use what's called the erbium resurfacing laser. It's a very, very powerful deep laser. It takes about 6 weeks to look this good. It's at least 3 to 4 weeks of downtime with redness and a significant healing time associated with that procedure. But there's nothing that is as deep and as good as erbium laser for improving the texture of the skin. And the reason we chose lasering on her is because you can see not only does she have the discoloration, so the erbium laser will treat the discoloration, the fine lines of the forehead. They'll also treat all these significant lines around the mouth that after a while you just get fatigued with fillers. You just kind of want to, what's the next step? What can I use besides fillers to treat these areas? And you can see with just laser alone, you get complete effacement and just complete wash out of those lines with this laser, because it just goes so deep and resurfaces skin, causes new collagen to come in, and the skin really thickens up. So you can see the difference in the skin pigmentation, the amount of lines and skin changes as far as the with improvement just using a laser alone. So our laser in the operating room is very effective. It's a tough procedure to have to go through. I never sugarcoat it for patients, but the results are unparalleled. And if you're really looking for a significant improvement, that's what we would do. However, having seen her after photo here, she has not stopped. She continues to maintain her skincare regimen. She continues to perform laser procedures and fillers as she needs to. So again, we keep going back on that same mantra that this is not just a one-stop shop and you're done kind of thing. You keep bouncing back between the surgeons and the nurse practitioners for the best results. Again, a surgical patient is a man having his eyelids done, the upper eyelids and the lower eyelids. Sorry for the blurriness of the picture, but I couldn't find the original, so I took it from the website. But you can see in the lower eyelids of this guy, the protrusion of the fat pads on the lower eyelids. We take that away by going inside and taking the fat pads away and then blurring the margin between the lower part of the eye and the cheek. That tear trough is blurred by putting some fat grafts in that area and smoothing that out, and then just removing the excess skin that's falling over the eyelashes. So in the after picture, you see a very happy man that still looks like a man. We try not to feminize men by taking away too much skin or making them look too hollow. We still want to make them look masculine. And so very happy with that. And then seeing, you see much better without all that shadowing from the excess skin. So, again, I don't want to delve too much into surgical procedures because I want to have time for questions and not try to take this over an hour, this Zoom meeting over an hour, but just showing you some of the things we can do to keep patients young, happy, and maintain the youthfulness of the skin and the subcutaneous tissues of the skin of the face. So with that, I'm going to open up to any questions if patients have, or if you just want to raise your hand or ask us in the chat. Or also if Kimberly wants to add anything as we kind of wrap it up.
All right, so as we wait for some questions to come in, I know what I wanted to add. The other thing that we can use lasers for, I know we're talking about facial rejuvenation, but sometimes we can help to treat some of the color and texture of scars with some of our lasers, depending on the depth of the laser that we use. So that's also just something interesting to add on. And as we were talking about the Kybella, where you showed the photo of the submental fat, we can also begin to use that in the axillary region where some women specifically may have like a little bit of like what they call like the bra fat kind of thing. We can treat that with the injectable Kybella. I think those are just two extra things to add.
Yeah, I agree. And what I wanted to add to all this was, as we wait for any questions to come in, or maybe we did such a good job that there's no questions and everybody's an expert now, which would be ideal. But our consultations, with our nurse practitioners, you'll get a full facial assessment, obviously, and address any questions. And we talk about the face here, but our nurse practitioners, Kimberly touched on this, and also the hands are a very common area that's treated to fill in the gaps between the tendons with the thinning hands. We also do lasers to the back of the hand and some peels to help with the photopigmentation, photojamage is least commonly seen on the hands. We'll treat the décolletage or the skin surface of the neck. The nurse practitioner will treat. So we're concentrating on face here, but they'll kind of assess all areas that you're concerned about, and then during that consultation can do a treatment if they have time that day, or if give you an idea of what they would recommend, and we can give you a cost estimate for that, and maybe even build out a schedule. Over the next 3 months you'll get this many halos, and you'll have fillers at the end of the 3 months, and kind of put it all together so what your capital outlay would be, what the expense of the procedure was, and then you can kind of decide which you want to partake. And the same goes with the surgeons. If you have a consultation with the surgeons, a lot of times I'll see patients that are really young and actually don't need any surgery, in which case I'll point out the areas that we can improve non-surgically, and then probably send you back to nurse practitioners or perform some fillers and stuff like that on patients themselves. So that's very commonly done as well. And then if you do go to surgery, I touched a little bit about our procedure. All of our surgery is done here at this office. We have a full board certified and state licensed surgery center. We have full board certified anesthesiologists to come to put you to sleep, to make sure that you're totally asleep the entire procedure, and come out of it really nice and comfortable and safe and healthy. Some patients will spend the night in our overnight suites. Other patients will not need to, and they'll go home. And we can give you more information on that as you come in. Feel free to email us, call our office for any information that you may want on any of the procedures we talked about. And finally, I will say that we have already had one very successful week of our month-long luau special, and we have 3 more weeks, including this week. We have 3 more weeks of specials. So now that you've heard about all this information and kind of what you're thinking about, you can log on to our website right now at our ppps.com store, or just call our office directly and we'll tell you how to do that. And there are still specials on everything from skincare, peels, lasers, certainly on the fillers and Botox and the neuromodulator we discussed today. So all that right now, since we can't do anything else during this virus downtime, all that is for sale. In the hopes that everybody will buy now, and when we get back to full business, we'll come in and get all their treatments done at that point and be ready for the holidays. So that's pretty much all I wanted to say for this meeting. Check out our luau specials, and thank you for those who logged on. Thank you for listening, and those will be listening to it later, and we'll watch it later at home. If you have any questions, email us with any questions, or just come in for a consultation. So I want to thank Corinne, our marketing specialist, for setting this up. I want to thank Kimberly, our newest nurse practitioner, who came down in January to join our practice, for being on the call. And thank you guys for listening.
Thank you. I hope everyone's families and everyone stays safe and healthy during this time.
Thank you. So with that, we'll end this meeting. Take care, everybody. Have a good afternoon.
Bye.
Bye.